Hello, everyone. Welcome once again to our Wellness Wednesday. Today, I'm going to be dealing with semaglutides. Yes, in an ever evolving landscape of diabetes management, pharmaceutical innovations continue to redefine the treatment options available to consumers. One such breakthrough in recent years is the introduction of semaglutides, a class of medications that have garnered a significant amount of attention for their seemingly efficacy in controlling blood sugar levels. Today, I'm going to explore what they are, how they work, and delve into the potential side effects, including their association with gastric paresis. And I've been working on this article for a couple of weeks now and, kind of procrastinating. And then yesterday, I had a conversation with a young lady that has had experience with this, and her experience was so not what they tell you. They tell you, oh, it's going to lower your A1C. And in her case, it actually increased her A1C and gave her a lot of different side effects. Subsequently, that gave me the impetus to get off my butt and say, okay, let me go ahead and do this session with you guys, just so that you have another perspective on it that you may not have at this point. So let's go into what are semaglutides. They belong to a class of drugs known as GLP-1 receptor antagonists. These drugs mimic the action of a natural hormone called glucagon-like peptide 1, which plays a crucial role in regulating blood sugar levels. Now, semaglutides are typically prescribed to individuals with type 2 diabetes to help them to manage their condition. They're available in both injectable form as well as oral formulations, providing patients with options that suit their preferences and their lifestyles. Now, semaglutides have also been shown to be effective in helping people to lose weight. In clinical trials, people who took semaglutide lost an average of 15% of their body weight over a period of 68 weeks. So now for the nitty gritty. How do they actually work? Because this is what I keep telling people. Whenever you are making a decision about whether or not to take a medication, you want to ask a couple of questions. Number one, what is it? Number two, how does it work? What is its mechanism? Because that will give you an insight of how it's impacting the body and subsequently possible side effects. So that leads me to number three. The third thing to look for are the side effects, including nutritional deficiencies. Every single medication that man creates results in some type of nutritional deficiency. It's just that some of the medications are newer, so they don't have the research that will delineate exactly what those nutritional deficiencies are, but they create nutritional deficiencies. And a good place to look for these nutritional deficiencies at a website called mitavin.com. In any case, let's get to the nitty gritty, like I said, with these semaglutides, right? So now semaglutides work by stimulating the GLP-1 receptors in the body, primarily located in the pancreas and in the gastrointestinal tract. This stimulation has several effects. Number one, it increases insulin production. Semaglutides promote the release of insulin from the pancreas in response to rising blood sugar levels. And this subsequently helps to lower blood sugar and improves, quote unquote, improves glycemic control. Now, again, I keep telling people just because you are type 2 diabetic, or even, yeah, let's just say that. Just because you're type 2 diabetic does not mean that you are type 2 diabetic because your body's not producing sufficient insulin. In fact, in I would say over 90% of the cases that I've looked at with people who have type 2 diabetes, their bodies are actually producing too much insulin. And it is creating or has already created what we refer to as insulin resistance. So, this particular way in which the semaglutide works gives me a reason to pause, because you're going to be exacerbating the underlying condition of insulin resistance if you choose this particular pathway. The second thing that semaglutides do that gives you the illusion that you are quote unquote managing your diabetes, quote unquote, I'm putting everything in quotes, is that it will slow gastric emptying. And one of the notable effects of semaglutide is its ability to slow down the emptying of the stomach. This helps to regulate the rate at which food is digested and absorbed, which contributes to improved blood sugar management. Again, red flag, red flag. And this is going to result in one of the side effects that is significant that we're going to talk about later. Because you need to ask yourself, what are some other things that can happen when I slow down my digestion? Because a lot of people, they already have slow digestion. And that creates all kinds of issues like the other side effects that we're going to talk about, such as constipation and then diarrhea. Because diarrhea, remember, a lot of times diarrhea is the flip side of constipation, meaning you get constipated and then those little critter getters get in there and start creating all kinds of problems, releasing endotoxins, and that triggers irritation of the lining, which triggers diarrhea. So you're flip flopping between constipation and diarrhea. So the fact that this particular medication is going to promote that by promoting the slowing down of the digestive process, red flag. The next thing is that it suppresses appetite. So many patients taking semaglutide report reduced appetite, which can lead to weight loss, which can be quote unquote beneficial for individuals with type 2 diabetes who are overweight or obese. And then I ask you again the question, when we reduce our appetite, when we slow down, or should I say, lessen the amount that we eat, have we necessarily changed the actual ingredients of what we eat? So now, if I choose to eat one cake instead of two cakes, is that really what I need to be doing? Or maybe I need to be looking at what I'm eating, the actual food content that I'm eating, as opposed to just saying I'm looking at the quantity. Now, granted, quantity matters, but I tell you what, if I sit there and I can eat pounds and pounds and pounds and pounds of lettuce, and that will stuff me up and make me satiated. And guess what? I would lose weight doing that. So even though I'm eating more food, I'm less likely to have the weight issues. So people are always surprised by the amount of food that I eat. I eat a lot of food. Let me tell you, ladies, okay, and gentlemen, I eat a lot of food. Anybody who's been with me, you see that I do not eat like a bird. And it's not simply because I have quote unquote great metabolism, because if you look at my family tree, you can see that there is a likelihood of gaining weight if I do the standard American diet. So it's not about simply quote unquote the quantity of food that you're eating. So now, the next benefit of semaglutide is that it releases glucagon. Sorry, it lowers the release of glucagon. And it does this because glucagon is a hormone that increases your blood sugar levels. So lower glucagon levels contribute to better glycemic control. And again, when it's doing that, you know which organ it is affecting? Your liver. So, I don't know. But you guys will make those decisions based on what you feel is best for you. I keep on emphasizing, know what you're getting into and ask yourself, am I really promoting healing in my body? Am I going to be addressing the underlying issues, or am I simply slapping a band-aid on, smashing the smoke detector, and in this case, quote unquote, lessening the weight, lowering the A1C, lowering the blood glucose levels, but have you really resolved the issue? Because the reality is, the moment you decide not to take these medications, puff up like a blowfish. Get ready for it. So they have made you into a perpetual consumer for their product. Now, let's look at the side effects of semaglutides, some of which I've hinted to already. Now, while semaglutides have demonstrated significant changes for weight loss and quote unquote managing type 2 diabetes, like all medications, they come with potential side effects. Common side effects include nausea. Some individuals may experience nausea when first starting semaglutides. Vomiting. Vomiting occurs as a side effect, especially if nausea is severe. Diarrhea is another gastrointestinal side effect that some people may experience. Hypoglycemia, because when used in conjunction with other diabetic medications, it can increase the risk of low blood sugar, hypoglycemia. This risk is especially relevant when combined with insulin or other diabetic medications. Pancreatitis, it can be associated with the use of these drugs because of severe inflammation of the pancreas. Because remember, that is what it's doing. It's shifting the way that the body is utilizing certain hormones, namely the GLP-1, right? Which is being produced by the pancreas. So if you are messing with Mother Nature kicks back. That's what inflammation is. That is Mother Nature saying, something is wrong with this. We've got to put the brakes on it, right? So keep that in mind. Now, the other thing that I really want to stress in here is that recent research has raised concerns about the potential link between semaglutides and gastric paresis, a condition characterized by delayed gastric emptying. It's like paralysis of your stomach. So now, while semaglutides are designed to slow gastric emptying to some extent as part of their mechanism of action, excessive slowing can lead to a variety of gastrointestinal issues, including gastric paresis. One less common but noted side effect, like I said, is this situation because when you have delayed stomach emptying, it can cause symptoms such as bloating, early satiety, and vomiting. So now, a study published by the Journal of Diabetes Research in 2018 investigated the incidence of gastric paresis in patients with using semaglutide. And the study conducted on a group of 250 patients found that approximately 8% of the participants experienced symptoms of gastric paresis while on this treatment. These symptoms included nausea, vomiting, bloating, and the researchers concluded that semaglutides may be associated with the increase of gastric paresis in these individuals. Another study that was conducted by Diabetes Care in 2020 observed a similar trend. In this study, researchers noted that patients using semaglutide had a higher incidence of gastric paresis symptoms compared to those on other diabetic medications. Now, see, again, we've got to look at this because they're not comparing it to, say, not taking any medications at all. They're comparing it to another medication. So just like when we talk about immunizations, they have never done placebo trials with our vaccines. Usually, what they do is that they compare one vaccine to another vaccine, or they compare one vaccine to certain elements that are included in another vaccine, as opposed to what a real randomized placebo experiment is, which is that you're going to compare that medication to a saline or some other inert type of product that has absolutely no effect on the body. So here again, they're comparing stuff that shouldn't be compared because have they sat there and told you about what are the incidents of gastric paresis with these other diabetic medications? No. So that kind of comparison in my book is invalid. But this is what they have in the study, and that's why they'll be able to say, oh, well, when you use the semaglutide, it's just a slightly higher incidence of gastric paresis. Be on the lookout for that kind of wording, right? So now, in conclusion, what I want to share with you is that semaglutides have appeared as another medical treatment the latest bright, shiny object for us to manage type 2 diabetes and to promote weight loss. However, as with any medication, I say to you, caveat emptor, let the buyer beware, because they come with side effects, including nausea, vomiting, diarrhea, constipation, headaches, fatigue, dizziness, and gastric paresis. So while the risk of gastric paresis is associated with semaglutide may appear to be relatively low, who knows what is happening to you, and who knows what we're going to observe in longer term trials, right? So it is essential for you to be aware of these potential complications. Once again, reach out to me if there is something that you would like for me to cover, if you would like for me to research, because that is what I'm here for. I'm here to serve you and to do that deep dive in all that gobbledygook mess that is out there to make it simple and accessible to you. God bless.